You may have come across people who got very shaky teeth or very mobile teeth, not very functional, they cannot chew properly, and especially in the upper jaw, the bone is very soft. We call it cancellous bone, unlike the lower jaw, which is compact bone. So when you have soft bone or cancellous bone, a porous bone, and anything that makes that bone weak, the upper jaw bone gets weaker much faster than the lower jaw bone. And all the more if the patient has other medical conditions such as diabetes or osteopenia, osteoporosis, if they're on long-term medications, especially steroids, etc. So this can lead to what we call as a moderate to severe bone loss in the upper jaw or the maxillary bone. This leads to loss of teeth. Slowly the teeth start shaky and then they fall off. So there's basically not enough bone to put an implant. To put a titanium implant, you need sufficient bone. Substructure should be enough. So if there's not enough bone, then we have to look at other alternatives. The alternatives are, you can look at a removable type of denture, which is the simplest alternative. However, there are problems with it. In the sense, it's not firm enough. It sometimes doesn't hold very well. It can be a bit shaky when you talk or speak or smile or eat. So not very comfortable. And the removable denture will progressively produce more loss of bone in the upper jaw. So it's not a great idea. How do you preserve the whatever bone is left? It's by using implants. Now when there's not enough bone in the upper jaw, whatever little bone you want to preserve is not going to be easy unless you graft. You put in some extra bone, which can come from some other part of your own body, like the hip bone or the lower jaw bone. We can take some bits of bone from there and fix it in the upper jaw bone and let it heal and then use that bone for implants. The other option is to take support from the cheekbone or the zygomatic bone, which is just the adjacent bone. If this is your regular upper jaw bone, the cheekbone is very close by. So we have to use a little longer implant to engage the zygomatic bone. The advantage there is you do not have to graft. You do not have to take bone from anywhere else or from an animal source or from a tissue bank, etc. This is a graftless procedure, no graft procedure, where we just engage the zygomatic bone and you can make an implant. So a zygomatic implant along with a couple of regular implants can be used to fix all the teeth in the upper jaw. We fixed about 10 to 12 artificial teeth fixed on these implants, thereby giving you the comfort of a very firm set of artificial teeth, which doesn't shake or move when you talk or when you laugh, smile, and when you chew food. So the comfort factor is there, the efficiency factor is there. So when you use these implants, especially Zygoma implants, in a graftless method, it can be used when there is very little bone or almost zero bone in the upper jaw bone. So this advantage of the Zygomatic implant is what has made it very popular over the years. By the time it was first published in the year 2000 to now, we are seeing a huge increase in Zygomatic implants all over the world, in the best centers of the world, most of the universities in the world. The teaching programs for Zygoma implants have increased, training programs have increased, patient acceptance has increased, the success rates across the globe has increased, almost close to 98 to 100% success rate for these implants. So this high success rate, the high predictability is what has made this a very popular choice today.